Hi, I'm Tyson Franklin, and welcome to this week's episode of the Podiatry Legends podcast. The podcast is on to help you feel, see, and think differently about the podiatry profession. With me today, I have two podiatrists. I have Michael Carter and Cooper Garoni, and they are recent graduates. They both finished in 2021. So we're going to discuss what it was like in their first year of podiatry. And luckily enough, they are working at the Adelaide Heel Paint and South Australia Running Injury Clinic with William Kwong, who has been on this podcast as well, and they reckon he's a great guy to work for, which is good because if they said, "Oh, he was terrible," it would be really awkward. But he is a great person to work for. So, Michael and Cooper, welcome to the podcast.
Thanks, Tyson.
And like I said, I might change that introduction if I listen back to it later and I go, "That was awful." No, but it didn't. I think it worked out pretty well.
It's good.
So, welcome to the podcast, Michael. You did exercise physiology before you did podiatry.
Yeah. So I did a degree before coming into podiatry. Just obviously when I came in, just not really thinking, knowing that I wanted to be in the health profession, but not really knowing where to specialize in. Finished it. Had the plan of going into physio, and I wanted to do something more specialized, but my sister is a physiotherapist. And she actually shouted to me saying, "Hey, look, try podiatry," and went in and really enjoyed it. And here I am.
So it's interesting. She didn't tell you that, hey, you should be a physiotherapist. It's awesome.
No. So from her perspective, she'd been in a private practice and public at that stage. And she thought there's too many physios out there. There's not too much money in it. She's overworked. So all those kind of cards just shouted out, "No, this is not something that I really want to do." She just recommended podiatry. And to be honest with you, I didn't actually really know what to expect going in.
Yeah.
But I just enjoyed the whole degree, and I knew that I wanted to be in MSK. And coming out of uni as well, that was what I wanted. And I think Cooper can agree with that too. And we both lined it up with William, and 80% of the work at this clinic is all musculoskeletal. So really happy with the outcome.
Yeah, I think not doing physiotherapy was a good choice. Not that, every profession has its, plus and minuses, but I remember when I was doing dry needling and I was matched up with this guy who had the hairiest bum I've ever seen in my life. Like he's wearing underwear and we're doing this, and there was so much hair. It looked like it was a pair of jocks pulling a gorilla. And I'm looking, going, I would hate to be a physiotherapist and having to rub this every day. Thinking, nah, not for me. So Cooper, what about you? Why podiatry?
Yeah, so I was probably similar to Michael as well, but when I was younger, I had a few sports injuries and I was quite sporty, but could never really, I don't know, get out on the track and play and train with all my mates. So I always was injured. So I don't know, I went around and saw a few allied health practitioners and then went to specialists and whatnot. And I just really liked how they were able to sort of get me back on the track and playing with all my mates. So since then, I was really wanted to get into some line of allied health, but similar to Michael, not sure really what route to take. So I was planning on going to physio as well, but I didn't get a 95 ATAR. So got into podiatry, and I don't think you don't really know a whole lot about it going through school. So I just got into it. I wasn't really sure what to expect. But I was always planning on trying to move over to physio. But the more I was in the course, the more I loved it. I just really loved it. And I think with podiatry as well, you can there's so many elements of it. But similar, I loved most of the musculoskeletal stuff, the biomechanics, and trying to get people back out on the track.
Yeah, I think the profession, well, the association, has a lot to answer for when it comes to marketing the profession. Well, we have up here in Cairns, we have a careers expo that I go along to as part of this group called the Business Liaison Association. I'm on the board with them, been there for ages. And every year they have this career expo. There'll be people from physiotherapy there, optometry. You name the different professions there, podiatry, nothing. Mm-hmm. When I had my clinic, we used to have a stand there just to talk about it, but I'm thinking it's not my job to be promoting podiatry. The association should be doing this.
Yeah, I find that even when patients come into the clinic as well. They come in, most of them don't even really know what podiatrists do. They just think we cut nails and tidy up the skin. So
Yeah, and it's funny what you said about the ATAR too, where like your entry score to get in, depending on who has listened to this in another country. But yeah, it's like physiotherapy. It may be higher to get in, but it's really just a popularity score. It's not on how difficult, how interesting a course actually is.
Yeah, 100%.
So you both finished your first year. You've got a great job with William. So you've been exposed to a very extremely positive side of podiatry. So Michael, how would you reflect on your first year of work compared to what, say, university prepared you for to what you ended up doing?
Look, I fortunately, from my position, I actually worked in reception for 2 years prior at this musculoskeletal clinic with William prior to coming into the job as a graduate. So I had a really good idea with what to expect. But coming out of that university kind of bubble and shell where you're protected and you always have the backbone of that tutor and their help, you really get thrown in. But the good thing here is there was a really good 12-week program that William kind of talked us through. So we didn't really get thrown in with 12, you hear sort of like in previous podcasts of yours, I've heard people getting thrown into 15 to 20 patients a day, and it was never like that from the get-go. There was a really nice, smooth transition. And being biomechanical and, musculoskeletal, tends to be, you tend to have some more difficult cases. By having that guidance along, for that initial 3 months, really did help that transition. And yeah, look, that I found that really helped me.
So just to ask you a question on that though. So William had something set up. So over that first 3 months, he had like a step-by-step program to actually teach you on what to do. Okay, that's great. Because I reckon everyone should have that. I used to have the same thing, had like a 3-month program that when you started with me, you're either going to love working with me in 3 months or you were going to hate me.
Yeah.
And very few people ended up leaving, most states. So it's good that he had something. I just think it's important, especially when you first graduate.
Oh, absolutely. Absolutely. And even, just having that chance to talk with a mentor, someone who's been in the profession for 20 plus years, about those difficult cases and those different characters, and back when you're at uni, you really are sheltered in your own little bubble and you have that help constantly. But when you're one-on-one with the patient, that's obviously a different story. And yes, you can go reflect back on it in practitioner meetings and in those mentor sessions. But in the moment, you gotta, it's your clinical judgment, and you got to call. So, yeah.
Okay, Cooper, what about you? How did you find that transition initially, going from uni into the workforce?
Yeah, I'm the same, but I'm from Victoria, so I actually moved over to South Australia and didn't really know a whole lot to expect. I think
So you're from Victoria, and Michael, you're from South Australia.
Yeah.
Okay.
So I sort of moved over, and I they advertised the job quite well and went from step by step, like this is the program, this is what we'll do. We'll turn you into a good musculoskeletal practitioner. So that's the reason why I firstly applied for the job, because again, you're not getting thrown straight into the deep end. You do have there will be steps, and you can sort of plan the way you want to go about it. So I think, as Michael said, you're not doing 15 to 20 patients a day. It's more structured. So the first part you're learning, more about the just how to build a good initial consult and getting all that right. And then you move into plantar heel pain and then forefoot injuries. Yeah. So it was quite detailed, and you sort of didn't feel too overwhelmed coming out. So that was probably the big thing I took from it.
Yeah, I think what about talking with other graduates who went through with you? I assume when you first finished, you two are working there, but you both would have had friends that you stayed in touch with last year.
Yeah.
What sort of feedback were you getting from them about where they were working?
Well,
I'll just point out to anyone listening to this is not a William promotion podcast. This is just talking to you guys, just happens to be at William's clinic. Yeah. So there's all these people now that are writing his name down going, we're going to have to apply for a job there. Yeah. But you would have, because off before I press record, we spoke about how on some of the other episodes, some people have left podiatry, but you hear some negative things from some new graduates going, oh, yeah, my employer's mean. He wants to keep KPIs. He's nasty. I assume William keeps KPIs.
Yeah.
And he's a nice guy and he keeps KPIs. How weird's that?
Yeah.
So what feedback have you had from other graduates?
Well, my girlfriend's actually a podiatrist, funny enough. So she graduated the year I graduated too. So she works in a private practice too. And they're sort of a bit more holistic. They do mostly everything, but probably more focused on biomech, where we're pretty much 80% biomech. But she works 1 day a week where she's in a GP practice, for example. And I don't think that's the most enjoyable work for her.
No.
Because it is quite like you're limited. You got 20-minute time, you got 20-minute consult. You can't really form much of a rapport with the patient. You're just pretty much getting them in and out and cutting their nails. So that's we can sort of bounce ideas off each other and like reflect on both of our first years that way too.
Do you ever get home and you say, oh, I had such a good day today. I had this athlete in and I did this and I did that. And she's gone, oh, I just saw 24 EPC patients bulk billed and got treated like shit by the doctors at the medical centre.
Yeah.
What a great day that
I've
was.
got some funny stories, but I don't know if they're appropriate for the podcast.
Yeah, well, you never know. If you've listened to a lot of these episodes, you would know some people say some odd things. It usually comes from me. So Michael, have you had contact with anybody else that you've graduated with?
Yeah, I have. And look, to be honest, just bouncing back personally speaking, like I knew when I did podiatry, when I started, I was like, yep, I know I want to do musculoskeletal. But reflecting on, chatting to other new graduates, a lot of them graduate and they're unsure whether they want to go public or private. And I've had mixed responses. So I've had a couple of people who've just bounced straight out of their first job with an employer within the first month or two, and then others are loving it. So I've really, from my perspective, it's been 50-50.
Yeah, and I don't think it really matters. I'm not saying that MSK is better than routine foot care or whatever it is. It's finding which parts of podiatry you actually enjoy. The ones I feel sorry for are the people that are new graduates. They're thrown into medical centres, whole pile of bulk billing patients thrown at them, and they're just treated poorly. And those sort of jobs, I always say to them, if you don't like it, just tell them to leave and go, because there's a lot of good employers out there who want, and even if you like general work, there's still a lot of employers out there who aren't just throwing you in medical centres.
Absolutely. And you understand why those particular graduates want to leave the profession. Bouncing back on other episodes of yours, reasons to why people have left, because being mistreated and having bad employers. And, personally, if I got thrown into that situation, I wouldn't enjoy it, and especially if you're, seeing 24 people a day and you're being mistreated by, other staff, doctors, it's just not a good working environment. And I think that's a bit toxic. Yeah.
So, Cooper, what about you? Have you heard any negatives from people you've graduated? Yeah, that have graduated as well?
I have a close group of friends, and they're more like they've had probably mostly positive experiences, to be honest.
Good.
Yeah. Most of them are in private practice. I can't really speak too much on the public side, but most of them are in private practice, and even because I'm from Albury-Wodonga, which is more of like a tight-knit community. So I knew some of their employers before they were employed. So they were going into good places that had good foundations as well. So most of my experiences with all my mates they've been pretty good.
Okay, that's good. So I reckon any new graduate or recent graduate that's listening to this episode, if you're not happy where you are, I reckon first thing, talk to your employer and just let them know that you're not happy. And if they go tough, then you can always leave and go somewhere else, because there's a lot of good jobs out there. And there are a lot of happy podiatrists as well. It's not all doom and gloom. There's a lot of people that really enjoy what they're doing.
Yeah, absolutely. I think podiatrists are in quite high demand as well.
It's a great job. Like, I must admit, the first couple of years I worked, I really wondered, like, why am I here? What am I doing? Because going back 30 something years ago, nobody knew what a podiatrist was. You have to just try and explain it. Now, at least it's a little bit more accepted. And if you said orthotics, they thought it went in your mouth and go, no, that's orthodontics. It was just so frustrating. But
I find that even on
now it's great.
even on like the ads on like for private health insurances and stuff, no, they don't really mention podiatry in that cover as well. It's always physio, dentist, osteo, chiro. There's never really podiatry in the ads as well, which is funny.
Well, once again, I blame the association. I like to blame the association for most things. If anyone's listened to this, they're going, it's not always the, I know that. I know, I'm just joking. But it is one of those things, though, that I think physiotherapists and even chiropractors, they have promoted themselves really well. They made themselves like little mini gods, and they pushed their message out there. And I don't know if it was the association that really pushed it, or it was just physiotherapists individually really push themselves. I'm not sure. But we're all bound by the same rules. So why they, like when I was a kid, I had no idea what a physio was.
Yeah. No, look, the awareness is, look, you say it's better than probably what it was 30 years ago, but
Oh no, it's better.
yeah. Yeah, look, I'm not experienced enough to make that call, but still the number of times a day or a week, or, you get people saying, oh, what's podiatry? Oh, do you just cut toenails? And you just take a deep breath and you say, no, actually, this is what I do, and this is what I offer. And then they're like, oh, you know what? That's actually a really cool job, and that's awesome. You have an awesome work-life balance, and, you enjoy what you do. So that awareness is really, I think, in my opinion, I think it's still limited, but as you said, it's probably a lot better than what it was 30 years ago.
Yeah, well, what's funny, when I graduated and I chose to do podiatry, my thinking of physiotherapy at the time, going back 1983, 84, was a physiotherapist was a masseuse who had a degree.
Yeah.
Because that's the only thing I ever saw a physio doing, was just rubbing someone. There was no, they weren't using machines or anything. It was just hands-on sort of therapy. And I'm going, I really don't want to do that. Doesn't look too exciting. But as the years went on, all of a sudden they just put themselves higher up the totem pole.
Yeah. And like you said, that's probably a combination of a few different factors there, but, a big, strong push from their associations.
So one of the other things because normally we ask for talking points, and you said how a joint collaboration can create a win-win situation between employer and employee. So, Michael, I'm going to take it you wrote that.
Yeah, I did. I did.
So what's the win-win thing that you're sort of referring to?
Like numerous different things, but just having that right balance between the employer and employee as soon as you get into the profession, and knowing what you get into. And I think that, like we've already talked about, that first 2 months is really critical. Now you got to explain, you got to, obviously know what you're getting into, and enjoy what you're doing, and enjoy the workplace, enjoy the team. But there's heaps of different things I think we can do as new graduates to make sure it is a win-win situation for both the employer and the employee. And there's a lot of things I think you can be proactive and initiative of. But for myself, for example, look, I knew that I wanted to do this many hours, this many days, and see this type of clients. And Wheeler was really accommodating with that. And I think if you're really proactive and you take a lot of initiative, you can have that freedom as well. And you have that balance, that right balance between employer and employee. But for myself, I've gone out of my, a few times, like, well, Cooper and I have both done this, but we've also gone out and done separate courses. So the other cool thing about podiatry is that we obviously have a lot of different treatment modalities, and there's all sorts of different things we can do in podiatry, which I think is really cool. So, we obviously go on our dry needling. We're about to go do our advanced dry needling. We just came back and did a myofascial cupping course as well.
Okay.
We did a strength and conditioning course as well. So I think there's so many different things, and, it's a win-win because, obviously you're updating your skill set, but you're also, giving that, premium kind of patient care and treatment, which is, a win-win situation for both the employer and employee. So getting that right balance, I think, is really important from the get-go. And I think that can reflect into a lot of different things.
That makes sense. So Cooper, what about you? What was your thinking on that?
Well, I think for me, like you'd want both parties to be happy, but you do have to come to a bit of a compromise as well. So I think yeah, you want to just be open and honest for starters. So luckily with us, we're able to get that one-on-one time each week. So you can actually sort of build that rapport with your employee. And if you are feeling if you're not happy with something, or you want to go do some further CPD, or you may want to change your hours. So it is important to bring up those ideas rather than just keep slugging away, keep pushing through, because I think when you do come out of university, like the first 6 months, you're really eager and keen to get into it. But then, I don't know, when you roll around, it gets a bit colder and winter comes around, you sort of go, like you can fall into a little bit of a slump, especially if you're seeing lots of patients a day.
Yeah.
You just need to be confident in yourself to bring up certain things with your employee as well. So it's not just, so I'm sure the employee would be open and like they want to try and make you happy too. So you want to try, get wins on both sides, because ultimately, if you're winning and you can come to a compromise that the employee is winning, the clinic's going to win as well. So you want that big three.
Okay. I have a question for you both here. This is, I don't normally plan any questions, as you've probably figured out when you listen to the show. But you went to different universities. When you both probably started the same week or whatever, did you talk about was there anything that the other did at one university that they didn't do at the other one, that you went, oh, holy shit, we didn't do that? Did that happen at all?
I think my year, like mine was quite small and
So
really
which university did you go to, Cooper?
Charles Sturt University in Thaguna. So it's not like it wasn't a huge university.
Thaguna. Thaguna.
New South Wales. It's on the border of New South Wales and Victoria.
Okay.
But they run a really good podiatry course, and like you're exposed to treating patients in your second year. You have that one-on-one clinical mentoring. So
how many people were in your year?
I think there was 20 that graduated, or 22, but the year before me, there was only 7 or 8.
Okay.
So it was quite a small uni, but I think that I saw it as it had its pros, because you're able to obviously discuss, you're just more close with the clinical educators at the time, and you're able to really develop your clinical skills quite quickly, I thought.
Okay. What about you, Michael? You went to South Australia, didn't you?
Yeah, University of South Australia. So look, as far as I can tell, I don't think there's been any big massive discrepancies between.
How many people were in your year as well? Just out of curiosity.
20, I think, graduated from my
Okay.
year. So fairly decent. We started off, I think, with about 50, but just slowly and steadily, that's gradually fizzled out.
Yeah.
But no, with myself, I don't think there's been any big things between Cooper and I, like, any big discrepancies as such. But look, definitely, like, I really enjoyed my education there. I thought UniSA was great. The only thing, it really, similar to Cooper, we started treating in second year, but, you only really started treating MSK stuff, or specifically for us, MSK stuff, up until, back end of fourth year. So, it was very heavily focused with general, high risk, and a bit of peds as well. So, and I didn't really get that really keen interest until that peds and MSK started rolling around. So, look, and obviously with the uni here in South Australia, they obviously probably want to cover their bases and make sure you can do the general stuff and high risk stuff really well.
Oh, yeah.
So that's really important. But I didn't really get going with, MSK and peds up until pretty much last year. So look, I think if I could go back and change anything about the degree, it would be really just doing some more MSK and peds work and seeing it for a longer duration rather than just, about 6 months or so. So you are kind of thrown into the deep end, and a little bit when you do join a, MSK clinic or a peds clinic, but it's obviously important to have the general and high risk stuff too. So I think in terms of Cooper and I, we don't see a whole lot of that stuff, especially the high risk. But no, there's not really anything I can really point out. What do you think, Cooper?
I think, just one thing you were saying then, I think with most of your graduates, they like the high risk, didn't they?
They do.
Yeah. So I don't know. We were going through musculoskeletal stuff early third year. So I think most of the people that graduated my year are more in private practice. I just thought that
Right.
was interesting.
Yeah, and what I find interesting too, where some podiatrists say, "I know I'm into high risk feet and wound care. I'm not really into biomechanics," and other people say, "I'm into biomechanics, but I'm not really into wound care and high risk feet." But I actually think you should understand both, and you should understand both really well, because even though, like, you put an ulcer in front of me, I'm going to dry reach and leave the room. It's just I just can't handle it. I don't understand it.
Yep.
And yeah, realistically, if a patient took off their shirt and there's this big gaping ulcer there, I would know what to do to dress it. I would be able to cover it up. I would be gagging the whole time I'm doing it, and they would probably be laughing at me. But at least I would know what to do, and I'd have somebody else in my clinic look after it.
Yeah.
And I think from the other side, when I know people in high risk and wound care, and they go, "I have no interest in biomechanics," I'm going, "How? How can you not have an interest?" Because it's a significant part of looking after them as well.
Yeah.
I think there's nothing worse than, I completely agree with you. I think you've got to have that good understanding in both, but the number of times you've had patients roll in through the door and said, "Oh, look, I've had this issue in my heel or shin or whatever it may be, and my other podiatrist just didn't really do anything, or
Yeah.
they didn't know what to do." And it's kind of like, really? Like, just what about a bit of taping or just something to get them going? But no, I feel, I've been told, that first 6 months I think is really critical when you come out of out of uni, and you don't want to be diving in just purely into one ballpark. I think it's really important to have that broad understanding of everything and keep that foundation of everything, just in case, like you said, an ulcer pops up in front of you, you actually have an understanding of what to do, and you're not just referring them off straight away, but giving them the best patient care.
Yeah, I remember a patient came in and saw us once, got a pair of orthotics made. And then I saw that, they had a bit of hard skin on the feet, a bit of a corn. I said, "Oh, look, if you want to book back in, we can organise, like general foot care as well. Over a period of time." She went, "Oh, no, my other podiatrist looks after all that." And I went, "What do you mean your other podiatrist?" I didn't know you had another podiatrist. She went, "Oh, yeah, I see." I won't say their name. I guess she might listen to the show. And who was in Cairns. At the time, there's only one female podiatrist in Cairns, so she knows who she is. Anyway, the patient said to me, told me who it was. I went, "Why didn't you get them to do the orthotics?" "Oh, no, I don't think they would be, they'd be qualified in doing these things." Yeah, because she finished a long time ago. She's pretty old.
Yep.
Yeah.
She was in my year.
Yeah. Oh, look.
And I'm just going, I said, "No, she would have a fair idea." I said, "Her and I actually went through together." She went, "Oh, well, no, I think she's forgotten it all then," because I'd mentioned this problem, and she just kept saying, "Oh, it'll go away. It'll go away." She said, and I decided to do something about it.
Yeah.
I think we get them a lot of the time, because a lot of the people coming in referrals from places that aren't getting better, because we're lucky enough to have all these shockwave machines and lasers and stuff like that. So a lot of people come in, they've been elsewhere, and you do hear some interesting stories, because some practitioners have just got no idea sometimes.
Oh, no, it's true. And I think what worries me, and it's not that I'm not bagging on podiatrists here, but there are some podiatrists, there's one in Cairns that I know of particularly, who is just no good, just hopeless, just hopeless, shouldn't be working.
Yeah.
Yet if you try to put a complaint in to say this person is incompetent and shouldn't be working, and these are the reasons, have you got proof? Have you got? And just you know what? Don't worry about it. Just let them keep doing what they're doing.
Yeah. Another thing we pick up, like I completely agree with Cooper. We do get a lot of those kind of patients where they're like, "Oh, do you cut nails? Do you do callus and corns?" Yeah, we definitely do it. They come in and they say, "Oh, are you a physio or something?" So they really do, people come in for these injuries and they're thinking, they're seeing a physio or something. And then you explain to them, you actually are a podiatrist. Like, "Oh, okay." And they don't actually realize before booking in. So that's another thing I found as well. But there is definitely that discrepancy, you do find amongst podiatrists. And I'm sure it's not just in South Australia, but abroad as well, that, you lose that skill and that foundation, you don't want to be left hanging like that. Well, personally, I wouldn't want to be left hanging like that with no idea what to do.
Yeah, I think it's just important. I said this before we press record, that in life, in the health industry, you've got like a totem pole of, yeah. And some podiatrists, as soon as they graduate, they put themselves on the health totem pole, but they put themselves down the bottom. And I'm thinking, no, why aren't you at the top with everybody else? And the way that I used to think, I didn't care if the guy was an orthopedic surgeon, brain surgeon, whatever. We were both had a job to do. We both had a skill set. They can't do what I do. I can't do what they do. But they're no better than me.
Yeah.
And I used to go in with that attitude. And that's how I spoke to my patients, that I was as good as anybody else. But in this particular area, I'm better than anybody else.
Yeah.
And I think we've just got to have that sort of attitude. You're going to have like a podiatry chip on your shoulder.
Yeah, I agree to that.
Yeah, it is. I think if the whole profession just stood up, put the shoulders back, stood tall, and just went at the whole allied health thing, we would be far further ahead than physiotherapists.
Yeah, look, I don't mean this to be bagging out other health professions at all. But even when you go through uni, and you even find it in work right now, but there is that comparison with other health professionals as well.
Yeah.
And I found when I was going through uni, like the physiotherapist or whoever it may be, they almost almost look down on you almost, as a health profession, as podiatry. That's what I found. Where all you do is cut nails. And I don't know if that's something that's just personally with them, that's their misunderstanding of the career and what it involves, or whether that's the association not promoting our profession enough and detailing what we can do. But having those wild discrepancies, and physio saying nah, they can't do that, or or even podiatrists bagging out physio, there shouldn't be that deep comparison. I just don't think, because we should all be working together. We're all under the same health banner.
Yeah. Well, I've worked with a lot of physios in different groups and organizations, done talks and that with them. Very rarely do I ever hear a physiotherapist bag another physiotherapist.
Yeah.
Never hear it. But in podiatry, it is a constant belittling of each other over a certain skill set, or who's interested in one thing or another, but they do it to themselves as well. I'm just a podiatrist.
Yeah.
And I'm going, no, you're just a dickhead. It's good, nothing to do with being a podiatrist. You just, even if you were a physio, they wouldn't have been a very good one.
Yeah.
But they tend to, they try, and I was going to do a video on this about like mud crabs. Have you ever gone mud crabbing, caught mud crabs at all? Probably South Australia, still very popular. Yeah, so you get mud crabs, and when you get mud crabs, you put them into a big bucket or a big bin. You don't have to put a lid on, because they can't get out. Because as soon as one goes to get out, the rest of the mud crabs pull it back in all the time. And I find in podiatry sometimes there's podiatry that when someone's trying to do something, others will reach up and try and pull them down to their level instead of trying to actually lift them up. And I think some of the other professions, they're better at lifting each other up. When someone does something good, they lift them up. Whereas in podiatry, it's like, as soon as someone starts sticking their head up a little bit, there's a lot of people there really take pot shots at them.
Yeah. Oh, look, I obviously haven't been around for too long, but you can definitely see that. And, even just listening to some of your podcasts, there just seems to be quite a bit of negativity around the profession, which is disappointing. And,
but we're going to change that.
We're going to change that.
We are going to change it. That's the whole idea of the podcast, is we are going to change the way people feel, see, and think about podiatry.
Correct. And about each other and helping each other as well.
Yeah. And that's why I like having, I remember the first, I think, a couple of podiatrists I had on who had only just graduated, this a couple of years ago now. And somebody who'd been out for like 25 years sent me a message and went, why have you got new graduates on Podiatry Legends? They're not legends. And I went, it's not about that. It's about us just sharing knowledge with each other.
Yeah.
So I think, like having new graduates coming on and them sharing how they're thinking, somebody who's older, who's been out for a while, listens to this and goes, yeah, this is fantastic. At least we've got some positive minds coming through.
I think that's even new graduates would listen to that. That's even sort of, I don't know, paving the path that for new graduates to listen and really enjoy the profession. I think you need, all sorts of a what's the word?
Yeah, I can edit this out.
Edit this out.
It'll be in the video. Everyone's going to go, "Yep, nope, Cooper had no idea what he was talking about."
Yeah.
But we'll edit that part out.
Yeah, I'm trying to think of something, but I was sort of saying like, just it's good to have like every aspect of podiatry in one, and then like you're not just reaching one specific part. You've got your new graduates who can listen to the show as well. I think it needs to be a bit more broad.
Yeah, well, one of the things that happened for this show, which I didn't expect, was getting messages from students who were saying, "I'm in my second year. I was thinking about leaving until I listened to, this episode, and you were talking to this person, and all of a sudden I went, wow, that sounded just like me. I'm hanging around." And then got messages from them, 2 years later saying, "I've graduated. I'm so glad that I stayed in the profession."
Yeah.
And you sort of go, wow, it's not not your original intention for doing it, but it's sort of like a bonus.
Yeah.
Yeah. People always ask me why to do it. Fame and fortune. That's why I did it. Just wait for both of them to happen.
Yeah, well, I think it's great that you have this podcast so that you can just raise more awareness about how good the profession is and how much we can work more together.
Well, I got a couple, just two more questions for you, for both of you. One, if a student was listening to this now, so Cooper, what advice would you give a student right now? If they're halfway through the course, got 2 years to go, what advice would you give them?
Well, firstly, I think, you need to probably hone in what you want to do with podiatry. I think because podiatry is just a broad topic.
Yeah.
You want to obviously decide, or maybe you're not deciding halfway through the course, but I think eventually you want to decide which path you want to take, one being private, one being public, and sort of hone your skills in something you really want to do, but obviously be open to learning new things. But first coming out, you just want to act a bit like a sponge. Once you've found that little niche you have, then act like a sponge, get as much in as you can, learn as much as you can, and obviously, you want to try. Obviously, where am I going with this?
No.
This one.
I'll edit that out too. I should have said that. I don't know where you go. I'm just listening.
You want to find your niche, and then once you find your niche, you obviously just want to learn as much as you can, adapt your skills, and you want to be open to having a win for you and the win for your employee as well.
Okay. And Michael, what about you? Not new graduate, student halfway through, because you got to put yourself back where they are now.
Yeah.
What advice would you give them?
Well, first thing, as soon as you asked Cooper that, I thought, look, I'd be trying to step into the profession as soon as you can, whether that's with reception or whether that's doing a bit of research with it or just reaching out to other podiatrists or even listening to your podcast, just taking a bit of initiative and just working out, hey, is this something that I really want to do? Because personally, I thought that really did work really well with me because I knew that what I was getting into. So that's probably my biggest piece of advice for any person in second year, not really too sure. I would actually look a bit more into it and be stepping out a bit, trying to step out of your comfort zone a little bit and just working out, hey, what can I actually do with this and see if this is the kind of lifestyle and work balance that you would like. And similar to what Cooper said, when you are in the profession as well and you do graduate, just hold yourself to a high standard as well. Don't be shallow, really do put yourself first. And don't be afraid to change jobs either as well. You want to, employers are going to want you. And there's, like Cooper said, there is a high demand for podiatrists. So
definitely
just going into the profession or into any job and just knowing what you want and just setting it, and being really open and communicate with your employer as well, because you just hear it too often about people in the profession that just, leave after 1 or 2 years because they just don't like it and they're just not, confident to be themselves and be open with their employer. So those are probably my main points.
Yeah. And some people, podiatry is just not for them. I'm sure there's a lot of people that have done podiatry and leaving is probably the best decision for them.
Yep.
and then it's up to them to sort of find out what they want to do. Out of curiosity, Michael, how did you find out about the podcast in the first place?
I actually first, like, honestly, it was by chance. I looked up because I do a lot of driving, and I was like, surely there's a podcast on podiatry. So I looked on Spotify, and they popped up, and I was like, wow, there's all these podcasts, and I started flicking through and listening to them. So that's how I picked it up.
That's how I picked it up. Was I went to search something on podiatry, and there was none.
Yeah, right.
And I went, I might do a podcast
Yeah,
with podiatrists.
Well, that's the thing. When I was going through uni, they got us to listen to quite a few different podcasts, and they were all physio or something else, about like a physiotherapist talking about lower limb issues. And
you know, the dumbest thing I've ever seen. Dumbest thing I've ever seen. Last year, they had a conference in Queensland on the Gold Coast. The association put it on, and they did a live podcast on stage with the physiotherapy podcast. And I'm just shaking my head going, serious? I didn't, like, fair enough, would have loved it to have been me. But there's a lot of other podiatrists out there now who are doing different podcast type shows. I'm thinking you could have got one of them who's a member of the association, get up there on stage and do their podcast, and you brought in a physiotherapist, and you probably paid him to be there because they knew who it was, and they don't do nothing for free. So you're sitting there going, that was just crazy. Not that their podcast is any good. The podcast is good. So, Cooper, what about you? How did you find about the podcast?
Well, actually, in that 12-week program, like once we come out of uni and join the workplace, William actually hinted me down the track and said, listen to a few of the episodes. So I think, that's how I'd come about it. Just Will.
Good tip, William.
Yeah, thanks, Will.
Okay, I've got one last question for you both before we wrap up. I've never asked anyone this question before. So this is going to be a tough one. Okay. So I have done ones before where you go, hey, give us a bit of advice. You're at a bus stop and someone comes up and talks to you. This one is, okay, Michael, you first. You're on stage. There's 1,000 of your peers in front of you that have been out 5, 10, 15, 20 years. What's something that you would like to tell them if you could?
Actually, probably the first thing that pops in my mind right now is I think there's just so much opportunity in our profession to do so much more. And I kind of I touched on this topic before. You know, I think there's so many different ways we can help patients and treat patients. And I think there's, you know, you come out of university and you have, you know, a basic foundation of things. And for example, I think when I was at university, I think like in terms of like just strength and conditioning.
Yeah.
Obviously this kind of stems back from my, strength and conditioning course, which I did before. You know, I think this is a standalone thing with podiatry. I found that, you know, look, there was not really much of a strengthening focus. So I think there's just so much more that we can actually do within the profession, even just looking down, for example, with strengthening, you can do so much with it and get a better understanding of strengthening and what you can do and how to treat it. And rather than just giving someone, you know, double leg heel raises, you know, there's so many different alternatives. So if I had a bunch of peers in front of me, I said, I would probably go on down a track or something like that, saying, look, you can branch out, you can learn so many more different things in the profession. You can really expand your skill set. So that's what I would say.
No, that's good. Cooper, what about you? You've had time to think about it now.
Yeah, I know, but the thing that popped into my mind was exactly the same sort of thing. But I think coming out of podiatry, like, you just want to obviously get as much CPD down as track, because when, for example, you're doing dry needling and more often than not, you just tend to hit the same points just in the back of the calf muscle. But I think you just don't want to fall down that rabbit hole of doing the same thing. So yeah, you do want to get yourself out of your comfort zone a little bit and look to not only push your skills, because I think it's going to help get a better patient outcome, but just learn new things and adapt what you already know, because doing the same thing over and over does get boring. So
it's true.
Just learn as much as you can and just bring new ideas onto the table.
Yeah, it's funny you should say that, because the episode I did earlier on today with Mike Donato, in America, the president of the American Academy of Podiatric Sports Medicine, and he said the same reason. That's how he got into sports medicine, because the side of surgery that everyone was going down, it was the same thing. They were doing slightly things different, and they might be doing one technique and then they do something different, but it was pretty much the same thing. Whereas he found sports medicine was just so interesting. And he mentions people like Simon Barthold and Craig Payne coming over and doing talks, and there was always something new to learn.
Yeah.
And I think in podiatry in general, there's just always something to learn. I reckon if you haven't gone to a conference, you haven't done something for a number of years, then you need to get off your ass and go attend something.
And I think that's you have to do that yourself. You need to be proactive yourself. Because you can just get, obviously you rock up 9 to 5 and then you go home and that's it. So you want to you do want to push the boundaries a little bit and not just fall in that same rabbit hole.
Nope, I definitely agree. So are you guys going to the conference this year, out of curiosity?
We actually brought it up last week. I think we are.
Yeah, it doesn't look very good, but it's I know there's a couple of interesting talks.
You might get the podiatry gig this year, the podcast.
Yeah. No, I don't think they're having one.
Yeah, we definitely would be keen on going. It's just whether or not there's something that's pretty interesting. We don't want to go along and be thinking, looking at each other the whole time and thinking, we already know this.
Yeah, it's not so much that. Like, I've had a look at the conference itself, and it's okay. Yeah, it's okay. Like, there's a couple of talks which are interesting, but when you look at it over the 3 days, you go, yes, a bit of same.
Yeah,
going
I think even something like that would be unreal. Like even just getting out of the clinic and going on a bit of like a work trip. I think that just all part of it, good fun.
But I've always found when you go to a conference, even if it's a boring looking conference, it's what you learn outside of the room when you're just talking to other practitioners. I remember one of the first ones I ever went to was on the Sunshine Coast. And it was back when it was a national association that each state did their own thing. I remember as a new graduate, and I was at this table, I'm sitting there, and there was Simon Barthold, because Simon's so much older than me, but there was just all these different podiatrists there, and I'm just listening to the conversation. And what I picked up from that conversation was just going, holy shit, I can't believe I'm actually eavesdropping on all this. This is so good. Yeah. That's where the benefit of conferences are.
Yeah.
And even if you don't pay to go to the conference, just being in the city at the same time.
Yeah.
Well, and rocking up to the bars and the pubs where everybody goes to afterwards is just as valuable.
Yeah.
Where is it this year?
Brisbane. Yeah.
I think I heard from one of your previous, was it Hayley Uden was on a couple of weeks ago?
Yeah. She was great.
She was one of my uni tutors. She was great. But she mentioned she just likes to go along just for a catch up, I think.
Yeah.
Most of the time. So in that aspect of things, kind of relaying what Cooper said, just everyone in the same place at the same time in the same profession, I think that'd be pretty cool.
Well, it's one of those things. I had on my old podcast, I had this guy, he wrote a book called Fish Out of Water, and he said that he used to go to, I said to him, you go to so many events. He goes, yeah, but I don't pay for anything. I said, what do you mean? He said, I just rock up. He said, I just turn up with my laptop. I sit in the lobby of wherever the conference is on. He says, and then during the breaks when everybody comes out, he says, I close my laptop up. I chat with everybody. I go down to the bar with them, have a few drinks, carry on. When they all go back in the lectures, he said, I sit back out with my laptop and do more work. He said, I don't even go in. But he said, just being there as part of the thing. He said, and a lot of the times, he'll go to an event and someone's got a spare ticket for something because someone didn't turn up, and he ends up getting it for free anyway. So I'm not condoning that's what everyone should do.
Long fight for not even getting into the lecture. But
there's a lot of value just by hanging around the conference area itself. Yeah. So there's a tip for anyone who's thought about going to the Brisbane one and you're in Brisbane, but you don't want to pay what they're charging for it. Just turn up. Yeah. Just turn up and hang around. And you'll still get to talk to people anyway.
True.
Okay, guys. So I want to thank you both for coming on the Podiatry Legends podcast. It's always good. It's refreshing for me to see younger podiatrists coming through and seeing them so enthusiastic. So thank you very much.
Thanks heaps. Appreciate it.
Thanks for having us on. It's been great.
No, it's been a lot of fun.
Yeah.